right,
Good to see
everyone.
you guys.
Hello. Thank you guys for joining.
Thank you. Emily, it's great to meet you and to meet everyone else on the panel finally.
Yes, excited to hear about you all also do all different things. So really excited to talk to you all and learn about your current roles, your tips for future dietitians, and we'll drop their information in the chat there. You can follow everyone on Instagram, LinkedIn, however you want to get in touch with them. And we'll start with just going around. Antonio, we'll start with you. We'll go in the order I'm seeing here. We'll do Antonio, Emerald, and Jean. So if you could just tell us a little bit about yourself, your current role, and then also again where you completed your dietetics programs so we can give some shout outs if there's current students or alumni.
Awesome. So I've been a dietitian for 6.5, almost 7 years now. So I got my bachelor's at A&M University, my master's at Texas Women's. And what kind of makes me unique is that I made the poor or great decision to get my PhD. So I was in school for 10 years. It's paying off. I really enjoyed it, but it was hard. In terms of what I've done, in terms of work, I started out working in bariatrics, which is a really cool area to work in. I think a lot of people don't really understand how exactly to work with that patient population. And then most recently, I've worked as a diabetes educator the last 4 years. And I just started a new position with Novo Nordisk on the industry side. So I've done a lot over the course of my education and career. I do a lot of public speaking. This is my fifth talk in 5 days. And I just finished my first book, and I'll tell you guys about it later. But happy to be here with you all.
Amazing. Thank you. And thanks for joining us after so many speaking gigs. We appreciate
Of
it.
course.
Emerald?
Hey there. So my name's Emerald. I am a WIC nutritionist. I've been working in that field for about 2 years. I was working with DC for a little bit, then now I work in Virginia. So it's kind of unique to see like how they're a little bit different yet similar in the different regions. Here in Virginia, it's more like families. DC, depending where it's more like single parent household. So it's interesting to see that. And I got my bachelor's from Winthrop University, so represent. So good luck to all of y'all that are in school right now.
Thank you. And Jean?
Hi, everyone. My name is Jean. I am Taiwanese American. I was born and raised in LA, California. I moved into Boston for school, and I currently live in upstate New York. I identify as queer, neurodivergent. I have OCD and ADHD. I'm also a retired athlete. I previously competed in gymnastics, powerlifting, and springboard diving. Shout out to the Olympics because I've been watching that nonstop, and I'm sure I'm not alone. And I currently work in a virtual group practice where we specialize in the treatment of eating disorders through a health at every size and intuitive eating lens. I help people to rediscover their connection with their body and their relationship to themselves, starting with their relationship with food. And finally, I did my MSDI at Simmons University in Boston, Massachusetts.
Fantastic. And you must be really glued to the Olympics with being an athlete in all of those sports. That's amazing.
I really am. I'm like, on to the next sport, on to the next
Yep.
going.
Amazing. I have another question for everyone. It's kind of a three-part question. You all have a lot of different experiences and different things that you've done, but thinking about coming right out of school, did you know what you wanted to do right away? And what was that job search process like? How did you land where you are today, or how did you land your first role out of school? And do you have advice for anyone for the transition from being a student to working full time? And we'll go back to you, Antonio, and start with it.
Oh, okay. Loaded question, but I wasn't really sure what I wanted. Well, like most dietitians, we love everything. We love all areas, but have certain niches that we want to go into. But so that's the interesting and hard thing about when you get out of school is that you're at the mercy of the job market, right? So if you're in Dallas, if you're in Boston, if you're in LA or in a rural area, that's kind of the thing that I would encourage students to do is start looking ahead already. Maybe you want to move, or maybe you want to live in your hometown. Literally, the simplest thing you can do, but they don't tell us to do it in school, and we should probably know it, right? Is go to Google and say RD jobs, diabetes educator jobs, whatever job that you're interested in the city that you want to work in. And then looking at the salary ranges and all that, and it'll give you a lot more insight. It can be a little bit discouraging at first, but your first job's not going to be your best job. But I think the biggest mistake I see dietitians make is they start in a, for lack of a better term, a terrible, like toxic work environment that's underpaid and they choose to stay there. And I'm like, you got to get out of there. You've got to make friends while you're in school, connect with me, connect with everybody else on this chat. And we're all trying to help each other out, but it's hard to help someone if you don't know they exist. So it's so annoying to hear, but network, connect with us on LinkedIn, connect with people on LinkedIn, and don't get stuck in a terrible job position, and make sure you move out of it as soon as you can. If you end up in that position, hopefully you don't. Real
Yeah.
talk.
Yeah, really, real talk, really good advice. Thank you. Emerald.
Hi there. So for myself, in school, I really enjoyed the community classes, culinary, and all the cultural stuff. And while I was in school, in high school, I thought, I'm like, okay, like this is the pathway, you get your bachelor's, you do the internship, and then you take the exam, and then voila, you're RD. But of course, during school, a lot of plot twists happen. They added the master's, you had to do that. And then of course COVID happened, and then everyone has their own personal life things going on. So for me, it wasn't feasible to obtain a master's. Financial hurdles is a big one for a lot of people, or people that don't have the financial support from families and things like that, and you don't want to put yourself in a hole. So once I had the shock and realization of like, okay, like this isn't for me right now, I spoke to my advisors and my teachers, and I asked them and let them know what I'm interested in. Because for me, something I was familiar to is there's Wix everywhere. So I'm like, okay, this is a good way to get your foot to the door with nutrition. And actually, with certain Wix, they have their own internships for you. But of course, you need a master's to do that. But that's something good to know if you're in that type of situation. But anyways, I had to change course. I let them know I wanted WIC, and my program actually offered lactation classes. So my professor actually got me connected, and I was able to take one of her courses, which really helped me out and highlighted in my resume that I have breastfeeding education and knowledge. And this is something that can be built into other credentials in the breastfeeding world, like certified breastfeeding specialist or IBCOCs. So that's something of like when you talk about niches that I can go into too. But I became WIC before all of that. I was like, oh, holistic health, things like that. But I think WIC was meant to be, and now it's turning into more breastfeeding, things like that. But I would recommend for people, before graduating, just apply to the job, sit at the, library or computer lab and just start applying. Because with these jobs, it takes a while, especially a government job, for them to do background checks. Some of them do fingerprints and all of this stuff. So they're probably not going to need you within a week. You probably have a month or two before you get in. So if you're going to graduate, in a month or two, just go ahead and apply. And if anything, use those interviews as practice, because some of them you're going to see common questions. So just do it. And it'll just make you better. And I also recommend, because as a newbie graduating, it's kind of weird to talk about money, but negotiate. Don't tell them, oh, I'm happy to make $8 an hour. Okay, I'm going to give you $8 an hour. Definitely go high. They're going to try to meet you in the middle. So just do it. And even if you don't, you're confused, but look confident, act confident. They don't know, a lot of times you're doing virtual stuff like this. And then with that, with becoming, let me see, what was your other question? See, what advice? Transition. So with the transitioning, most of these jobs, they'll teach you what they need you to know. In school, you're learning organic chemistry and all of these things. So like, okay, a lot of us are not really using that, and that was really hard. Your job will teach you what you need to do. You just need to narrow down what interests you, like Antonio said. So whether, for me, for example, I'm very visual. making a little big chart of like, okay, I'm interested in this at the third and narrowing it down. That really helps. I like herbs, I like gardening, I like cooking, I like babies, and just try a little bit of everything. When you first go into it, use it as a buffet, try everything. When you get into those junior, senior years, narrow it down. It's okay, you still don't know, but you just got to narrow it down so you can focus on those credentials that'll highlight you. And one other thing that I know everyone hates, well, most people hate food service, that Serve Safe certification, almost everyone liked it during the interview. I'm not sure why, because I'm just like, okay, you're not really gonna use it here, but for whatever reason, they really like that Serve Safe certification. So definitely, get that done while you're in those food classes. But just be persistent, and I hope all of that helps.
Yeah, no, really, really great advice. Thank you. And it sounds like you were saying, you were narrowing down your interests, and where you've landed with WIC is like really what you're passionate about. So I love that you use the advice that you just gave when you were figuring out your pathway. It's great. And then Jean, we'll go with you. And I can repeat if you need me to.
Oh, no, I got the questions down in front of me. The fixations I got. So this will be a great juxtaposition, because I think I actually knew what I wanted to do before going into my internship. And this is really the story of the becoming of the dietitian that I am today. So as I kind of shared before, I was an athlete for probably 20 years of my life in total. I was already someone who exercised a lot, but something happened in college where there was a trigger point, and I got really into running and powerlifting, so much so that I became obsessed with my health and my body. And I think in the eating disorder space, colloquially, I would call that orthorexia. And it really manifested academically for me. And I really wanted to become a sports dietitian. And I don't think I really recognized just how unhealthy my obsession was. And I think that that's also something to talk about, that there's this incredible normalization of our field of the obsession with health. We're studying nutrition and health. So it's a really easy mask. And when I was an undergrad, I asked my sports nutrition mentor, how do I become her? And she told me that if you want to become a sports dietitian, you need to learn about eating disorders. And at the time, I didn't quite understand the connection, but in retrospect now, I think that there's such a incredible intersection between athletes and the eating disorder space. I think that athletes are intense and disciplined, and when there's a crossover of the eating disorder experience of I will do anything I can at any risk to control for outcomes. There's such a strong crossover and carryover. So I listened to my mentor's advice, and I started working at an eating disorder treatment center as a diet tech in 2017. And that was at the residential and PHP, which is the partial hospitalization program. And I had this sudden realization that my original motivations to be a sports dietitian was a guise for my own disordered relationships to myself. And so that really inspired a pivot for me to discover this experience that I had. How did I get here, and how can I help people who also are here too? So transitioning into like the job experience. So I applied into Simmons University knowing that I want to do eating disorders. And actually, there are only, for those that don't know, there are only two, I believe, two specialized dietetic internships that provide and offer a concentration in the treatment of eating disorders. The one other program is the Emily program at the University of Minnesota, which is a lot more clinical than the Simmons program, which is more community centered. And honestly, I just got my job word of mouth. I was just recommended to the private practice that I work in directly from my program, because there just aren't a lot of formally trained eating disorder dietitians. And it's not dietitians' faults. Like, that's just not offered in dietetic internships. And so if you're able to get formal eating disorder experience in your internship, that is just highly, highly recommended. Otherwise, most dietitians I know, their first experience was just in the wild, just meeting clients. And it's like, oh my gosh, I have a client with an eating disorder. What do? I wasn't trained in this. And that's their first experience, which is kind of scary. So my advice transitioning, or at least if you're a student, to be open with preceptors and professors about what you want to do and explore, and then transitioning from school to working. This is so generic. This is such generic dietitian advice, but I have to say is to find balance in your life. Like, you go from this intensity of studying and being a student, and all of a sudden that's gone. And I think a lot about how the pendulum will swing to the other side. When we're in one extreme, it's easy for it to shift to that other extreme. So find your balance.
Yeah, great advice there with that balance for sure. And thank you for bringing up too the programs that have that concentration, because I know we have a lot of people on here who are interested in that area. And we also have, we actually have a lot of great questions coming in. So thank you everyone for these questions. We're going to do the questions at the end, but also any of the speakers, feel free to like chat on the questions while you see them. We'll also go to them at the end. And now we'll do a question for each of you, just to talk more about each of your own unique experiences. Emerald, we'll start with you, and we actually have these questions already in the chat as expected. So we get a lot of questions about what it's like to be a WIC nutritionist. Could you share a little bit more about like your daily tasks, your favorite things about your role? Any tips about like the pathway to becoming an NDTR, or students who want to are considering pursuing that credential?
Yes, of course. So most of us know, but like WIC is a government program. It's for women, infant, and children, and it is income based as well. And another note that a lot of people don't know is you don't have to be a citizen to get it. So migrants, refugees, you guys, they can all get it. So I really like that, we're trying to help this vulnerable population. But in other words, this is a free program to many, many families. And especially in this area, Northern Virginia, it is very, very busy. So on an average day for myself, I probably see 15 to 20 families daily. Of course, there are some days it's really slow, but on average, that's a lot. And that's not counting how many kids are within those appointments. But luckily for me, I come from a food service background, and you got to be quick. You know when to make that appointment short or not. But anyways, a lot of the daily tasks is anthropometrics. You're going to be taking the height and weight of these clients. And for certain ones, like the mothers, 9-month-olds and up, you'll be checking their hemoglobin. We're going to be checking their iron. WIC is very big on that. And so a lot of the education and counseling I do is on iron and vitamin C, and how much milk you should give the children, and those type of recommendations. You'll be explaining how the WIC works. It's a card. It's not just, oh, you get $50 each month. That's something like SNAP does, but we actually give a certain amount for fruit and vegetables depending on your age and your status, if you're pregnant or breastfeeding. Then a certain amount of food, like this many gallons of milk, this much cheese, this much grains. So you have to understand that so you can explain it. And there's a list of certain stores that use WIC, because not everyone uses it. Like over here, like you can't use WIC at Sam's Club, but you can use it at Walmart, Giant, Food Line. So just educating them on that so they know what to use the card. We do, the nutrition counseling, and we do bits of breastfeeding counseling. Now, we do have a breastfeeding peer counselor that we'll direct people to, but they do educate us and train us on basic breastfeeding education, so you can help people that way too. But anything like medical, it's you need to know your scope and refer elsewhere. We do a lot of referrals, people that maybe need SNAP or need the dentist, or maybe food banks, or a lot of people ask about diapers. So knowing a lot of local resources where they direct these people to. And one unique thing I think, we do is we call it BAP surveys. Basically, when we have a pregnant mom come in, they'll send them a survey with a whole bunch of questions about breastfeeding. Or what does your husband think about it? What does your doctor think about it? Do you think you get more breastfeeding versus formula feeding? And so after they do that survey, maybe a month out, we give them a call and we go over that and just tell them about the benefits, or how come, did you know that your Medicaid will cover a breast pump for you and it's free, So a lot of these things are very helpful for them. So that's kind of what I guess a day in life would be. Other miscellaneous things would be like sometimes you're doing special formula approvals. You know, some of these babies have they're allergic to milk and things, so they have specialty formulas, and WIC covers certain brands of those. So those are interesting, of course, cleaning the lab and stuff like that. And for my WIC office, where I'm at now, I have my own office, which is really nice with a nice big window. I know a lot of, you know, nutritionists, we don't get that because in DC, I had to share. It was claustrophobic and, you know, it's totally different. So depending where you are, you might get your own office, which is nice. And it feels good, you know, you can decorate it and have a little distraction area for the kids with games and things like that. Now, a few things that I really like, or my favorite things about the job is, you know, of course, you know, there's opportunities where you get to hold the newborn because the mom didn't bring a cart or nothing. So that's always nice because like, oh wow, you know, they're so, you know, warm and glowing and stuff. And also, I'm not fluent in Spanish, but I know enough to understand clients and respond back to them. And I have really improved, especially in this area because we have so many Salvadorians and people from Peru and all sorts of places, especially Central America. So it's nice to see the clients like their face brighten up because it's like, oh my gosh, you speak Spanish. And I let them know I speak a little bit, but they get really happy about it. So that's really nice too. So depending where you're at, you might see like there's a population that speaks a language and, you know, just practice because it will get better. And some of these questions just repeat, repeat, repeat. Now, if I'm somewhere else at the grocery store and you're trying to talk to me, I don't know grocery store Spanish, but I know WIC Spanish. So that's something I like. And then also just seeing, you know, how much these people appreciate. A lot of these people, you know, like I said, you don't have to be a citizen. You have a lot of people that are coming from these different countries. They're just starting out here. And some of us can relate to that. Maybe our parents, you know. So they're so grateful. And so it's nice to have this moment feel like they're shaking my hand. They're like, you know, thank you so much. You know, I hope we see you again and things like that. And sometimes when I'm shopping, I see some of my clients in their way and they're like, oh, do you need help carrying your stuff? I'm like, no, no, I'm okay. But like, they really do appreciate what you do. I would say most of them do. So those are some of the things I really like. And now for the people who are interested in the NDTR credential, there's a few ways you can do it. There's a few pathways. I did mine. I got my bachelor's, the DBD verification, and you actually have to have your program director message the CDR registration people to be approved to take the exam. But a lot of people, if you have an associate's even, you can become an NDTR. They have their own way. I didn't take that way. I didn't know of that way, but anyone that's interested or just beginning in, you know, in the nutrition world, you may want to do that too. My coworker, she actually did that. She's a bit older, you know, in her 60s, but I'm just like, wow, I'm like, you have an associate's and you make like probably, she's been there for you. She's been at WIC for over 20 years and she's making like 70K. I think that's great. I'm like, wow, with just an associate's, like, you know, like, so some people think, oh, you know, you go up and you make more money, but you know, you can start where you're at too and just build up with credentials as well. So many options, many paths. You just got to see, you know, what works best for you. Some things I'd recommend if you're interested in the NDTR. There's a podcast for you called NDTR Spotlight by Marie Lorraine. That's very helpful to listen to and what other NDTRs are doing, whether in hospitals or chefs or at WIC offices like me, and a lot of other opportunities for you. And lastly, I would say just check out the cdrnet.org because that'll be the best probably resource for you to see what the eligibility is, what you need to do, and you know, talk to that program director so you can get ready to do it. I would say if anyone just graduating your bachelor's with nutrition, just take the exam. I feel very confident that you're passed because everything is so fresh in the brain. And I don't think I never taken the RD exam, but like I don't think it's as difficult. I passed it on my first try. I know RD exam people are trying like 7, 8 times. I'm like, wow, that's crazy. But like just take that exam right after you graduate. That'll be a nice stepping stone and it'll look good on your resume to get into wherever you're trying to go or just building a career off of it. So I hope that helps.
Well, yeah, we're gonna go to the next person, but thank you for that.
Yeah, thank you. That I think that also is helpful for people who are looking to get that experience or who might not have that experience in their internship and don't really know what the day-to-day in WIC is. So thank you. And Antonio, I know you're answering some of the questions in the chat. You had some questions about your PhD. So if you're curious about that, check that out in the chat. Antonio did drop some answers there. But I wanted to talk about what you briefly mentioned before. I know you just published your first book, so congratulations. Do you want to tell us a little bit more about the book, your inspiration behind it,
Sure.
the impact you hope it brings, all about that journey?
Yeah, I'll keep it short. I'm a straight shooter. I like to speak authentically because and that's really the reason I wrote the book. I have it right here if you want to look it up on Amazon, Diary of a First Generation College Student. That's me right there, but and it's easy. Most people that I've ordered it, and I had a lot of orders. I launched it this first week. They get it within a day or two. Just go to amazon.com if y'all can drop the link there. But in a world of fakeness, I try to be real because I think that's really what's helped my public speaking career is that I get invited to do talks on my PhD, like Hispanic health and what are the actual determinants of health, not the politically correct determinants of health. Uh, Another thing I taught, like one of my favorite talks to give is the macho man syndrome, how to help stubborn, resistant men, resistant patients, because that's a very distinct population versus eating disorders versus WIC. So all of us have a niche that we should try to get into. And so back to the book, the reason I wanted to publish a book was because I'm a first generation college student. So my parents are from Mexico, immigrated here. My mom and dad only went to elementary and middle school. And so even though I had older sisters, I was the first in my family to go away to college out of town, out of city. And then I was the first to get a master's, and then I was the first to get my PhD. And so the book, Diary of a First Gen, is about real talk advice on helping college students and helping motivating young career people. So just giving you the topics that are in the book, like literally chapter 1 is welcome to college, how to handle stress. Chapter 2, this is an important one. Google your future salary, how to choose a career you won't regret. So even if you're finishing college, like that's a good chapter for you to read on because you'll learn about how to choose a career path in dietetics you won't regret and how to change paths if you're on the wrong course. Staying happy, healthy, and mentally well, building a good network, building on your self-confidence, because I think a lot of times as dietitians we're perfectionists and we beat ourselves down. So yeah, the short answer would be it's a labor of love where I wrote the book to help people out there that are suffering kind of like I did in the past with anxiety, panic attacks. How do you overcome public speaking fears? How do you overcome imposter syndrome as you're entering a career and all that? And that's why I wrote the book so that people in college, going into college, or even people who are about to wrap up college, those are all things that we should be more open about to talk about. Things like salary, things like giving advice on choosing a job, how to rebuild your confidence, how we all struggle with mental health. So yeah, please check it out. Amazon. I'll drop the link in the chat here in a second, but share with your friends and I'll answer any questions if y'all have any at the end, but I want to leave time for Jean.
Awesome. Thank you. Such important topics. And I think a lot of people can really find value from your book. And yeah, thank you. I see Emerald's in there too, answering some of those questions about the NDTR. So Jean, we'll go to you. So you have like 7 years of experience in the field of eating disorders. And then you also, like you said, you knew what you wanted to do before the internship. So you were able to complete like rotations at a variety of centers and private practices. So for students who are looking to gain experience in this field, what would you recommend they do or look for as they go through your schooling, their schooling? And then can you talk a little bit about working in the eating disorder treatment center versus working in the outpatient group practice that you do now?
Absolutely. So for the recommendations going through schooling, experience is definitely the first thing I'd recommend. So if you have the opportunity and access, I also saw some things in the chat that there are more spaces in the dietetic internship, other dietetic internships outside of Simmons and the University of Minnesota, it seems like, that provide some more formal training in eating disorders, which I think is so much needed. But to say, I can't speak for any other programs besides Simmons, but to say, I definitely had a very comprehensive experience in person. I got to experience I got to experience a rotation at every single level of care in eating disorder treatment. I think that is a very secure way to be qualified in the eating disorder field. And if not with those internships, then I would say research the dietetic internship programs that you're interested in, contact the internship directors and ask them in advance. So send an email to let them know, to ask if they can provide any rotation opportunities in any eating disorder spaces, or ask if you can develop a new rotation site. So seek out your own relationships with prospective preceptors at eating disorder treatment centers, at private practices that focus on eating disorders. Like literally just Google, find them yourself, contact the dietitians, be like, hey, I'm really interested. Would you be open to precepting to see if that can be an option for your hours? Again, I think that experience beforehand, before you become a dietitian, can be one of the best things that you can do as a student. Outside of that, definitely think that there are a lot of resources that you can read. There are many books that I think that in traditional dietetic schooling doesn't necessarily recommend or provide. So I can certainly share a list of resources. A few books that come to mind are Sabrina String's Fearing the Black Body and Belly of the Beast by Deshawn L. Harrison. Another great book is Your Body is Not an Apology by Sonia Renee Taylor. I think those are all really, really good starts that don't seem like traditional eating disorder books, but it really introduces how the eating disorder treatment space is going to entail so much more than just the food experience with a person. It's going to entail how the person experiences their body, which is going to include their multiple identities. So their race, their ethnicity, their culture, their abilities, their neurodivergencies, et cetera, et cetera. Okay, moving into the question about the experiences of working in different treatment centers. I can talk about this for a long time, so I'm going to try to be fast. So to really quickly share, there's 5 levels of care in eating disorder treatment. From greatest acuity to least acuity is inpatient, residential, partial hospitalization, intensive outpatient, and then outpatient. And I currently work in the outpatient level of care. In my internship, I had 2 to 6 weeks at every single level of care. Personally, where I've worked was the partial and the residential, and then the outpatient. So I'd say I've had mostly middle, upper to lowest level of care. So at the highest level of care, it is going to be very clinical. They're going to be looking at labs all the time, greater medical acuity. There is more urgency in your day-to-day experience, and there's going to be more rapid patient turnover. And there's also going to be more protocols and structure to your day of like being told how to navigate a situation, which I really like. But I think that also comes at the cost of an ethical dilemma of having to be the enforcer of a population that sometimes may be unable to provide consent. And this gets into a really complex topic in eating disorder care, because eating disorder treatment models mimic psychiatric institutions, which makes for a very carceral or prison-like experience for patients. And this is hard because I think that can be life-saving on one hand for many people, and also very traumatizing sometimes. And I don't think it has to be that way. I don't think it has to be traumatizing. I think it could be life-saving and healing. And so that's just a little bit of my abolition advocacy. And honestly, I think my biggest obstacle to wanting to go back into working at a higher level of care personally. So at the lower levels of care, which I am very biased in since that's where I currently work, there's a lot more relational work. There's a different type of clinical work that happens because you really get to do the deep dive of the complexities of what's really going on. And so you really get to see this multifaceted experience of how people's health is determined by so many different factors. I think that that's really cool. There's a greater long-term experience with your patients. You get to witness change, which I think is very beautiful. But this also presents for a different ethical dilemma, because at the outpatient level of care, there's such a wide variety of presentations that I'll see, because the outpatient is the first step into treatment. And so many people are just not appropriate for the outpatient level of care, but they will be there. So they will come and show up and they really need more help, but they do not want to go to a higher level of care. They refuse that, they decline that, they're resisting it, they're in denial. And treatment is meant to be voluntary. And at this time, it almost becomes like this ultimatum of like, if you don't go to a higher level of care, I'm going to drop you as your dietitian, or I'm going to terminate work with you. And then it brings in this really complex experience, right? Of like, oh my gosh, now we're threatening the patient. And what if we terminate and they still don't go to a higher level of care? So now they're also not getting this support that they need. And they're also not getting support from me. So it's like, okay, what's the better solution here? How do we keep this person safe? And so there's this need to evaluate if your patients have the capacity for decision making. And then as the dietitian, this decision falls into, can you reduce as much harm as possible for this person? And that's really complex. So honestly, when it comes to the different levels of care, I think that it's gonna be about, the fit's gonna be about your individual capacities as a human and a dietitian, depends on your speed and what kind of work you want to do. This is a topic I can certainly dive into for a long time, but I will leave it at that for now.
Thank you. It's so insightful, I think, for a lot of people who are interested in going into that space, kind of what the different levels of care are. And we did have a question from someone about getting how to get experience and then knowledge to work in the setting with this population. So a lot of those books that you mentioned, I'm sure, and a lot of those resources are a great way to get into that. And we're going to do one more question for all of you. We may have a minute or so after this question to go into the salary conversation. I know that there was some chatter in the chat there, but we'll do this one last question for all of you, just a quick one. If you could give a piece of advice to yourself 5 years ago, or kind of more 6, 7 years ago, when you're like just starting out after schooling, for the students that are tuned in today, what would that piece of advice be? So just like a quick little snippet piece of advice.
I can go real quick. Nobody cares about your finances other than yourself, so you have to protect yourself. Because while you're in undergrad, while you're in your internship, your professors want you to do good in school. Your volunteers want you to keep volunteering. So don't lose sight that once you graduate, right, as an adult, your main responsibility is to have a salary and have enough money to have a good life. And that's really difficult if you let yourself get pushed over by a bunch of people. I can't remember what else I was gonna say on that, but yeah, just focus on your finances. Don't make terrible decisions on your finances. You know your life, the life you want better than anybody else. So just be careful, and I'll leave it at that.
Yeah, great advice. Thank you. Emerald?
For me, I would say why the rush and a change of direction isn't bad. I felt like in school I was just rushing, like to get at that point, I wanted to get the RD, and I'm like, why does it have to be this certain timeline? So just it's okay if it doesn't happen in that timeline. Like what is supposed to happen will happen, and it'll get there if it's meant to be. And then a change of direction may be good. Now like I'm into this maternal area and going deeper into breastfeeding, and there's a niche going there. So don't always look at it as bad. It may be needed and where you're supposed to be.
Great advice. And I think a lot of people in the chat, and like Jenny said, like there's no normal path, there's no normal timeline. Everyone, clearly with all of our speakers, everyone does something different. Everyone is on a different timeline. Great, thank you. And Jean?
I would say to be honest with yourself about your whys, about why you really want to do this work as a dietitian. Continue to deconstruct your internalized ableism, healthism, fat phobia. Unlearn your shame and really get to know your authentic self and your needs, not other people's needs or what you've been told you need to have. Remember that we are meant to continue learning and growing. And that only happens when we have accountability with ourselves, because the better the relationship you have with yourself, the better you can show up as a compassionate dietitian with your clients and patients.
Yes, so important. Thank you. A really good message to end on. We have like 2-3 more minutes. And I know we wanted to have a little bit conversation about salary. Antonio, did you want to mention anything there?
Sure, yeah. Your career has to be a combination of your passion and your vocation, but also financial stability. In terms of salary, I think it's important. I can't speak for all states, but like I'll just give you the summary, right? Clinical, if you're going to work in population health, you're looking at 40, $50,000. Clinical, you're looking at 50, 60, maybe $70,000 after a while. Private practice, it's going to take you a while to get there, but it could be anywhere from 40 to 80 to way higher. But like your professors, I mean, you could literally just go to Google, look up your professor salaries. They're depending on where they work, they're making 80 to 140,000. So just be more inquisitive on that. And I'm trying to think. I would really look into big companies because a lot of times we demonize like, oh, well, the medication companies or the supplement companies, but we need well-meaning, compassionate dietitians to enter those industries. Because then, guess what? You do well financially, but more important, you change the culture from the inside out versus staying on the outside and complaining about medicine and all these systems aren't doing well. Well, go infiltrate those systems and let's go do something about it. So, and that's where you get typically like double the pay in salary, like 100, 120, higher than that, depending on what you're doing. And then the last thing I'll say on that is it's important to have like a side business, a lot of times initially, but don't let it consume you too much because I just see people spending so much time on TikTok and social media, which is fine if that's your long-term plan. But if you could be spending those hours making $20, $30 an hour as an RD, that might be better worth your time than anything else. So just watch where you're putting your energy and your time and effort, and don't be afraid to go outside the box.
Amazing. Thank you. And that's a fantastic segue into our next session. Our next session is about a dietitian working in industry. So thank you all. We had so many good questions. I know a lot of people got in the chat and answered those questions. You all have such unique experiences and brought so much knowledge to this. So thank you so much for your in-depth insights and being with us here today as we approach the end of the summit.